Hi, everybody. Welcome to my IBD Learning Virtual Program in Bowel Urgency in IBD. Bowel urgency, which is the sudden need to rush to the bathroom to empty one's bowel, is one of the most common and most distressing symptoms experienced by patients with inflammatory bowel disease. Today, we're going to talk in depth about bowel urgency to better understand the symptom and how patients can better manage and cope with bowel urgency in their day-to-day lives. I'm Sharon Dudley-Brown. I'm a nurse practitioner at Johns Hopkins University treating patients who have inflammatory bowel disease. I've had many, many years of working with patients with IBD, and yes, bowel urgency is still a problem. Here are my personal financial disclosures. This information that's shared is meant to be for educational purposes only and should not be replaced by any advice or guidance from your own healthcare professional. We want to say thank you to Lily. The Urgency Initiative is generously supported in part by Lily. So I'd like to just outline the topics that will be covered today. And we're going to start with defining urgency. Then we're going to talk about how common urgency is in IBD. Move on to the varied causes of urgency, because sometimes the causes can be incredibly important in managing urgency. Then we'll talk about the impact of urgency, talk about communicating with your healthcare team about urgency, and certainly closing with managing urgency in IBD. Defining urgency in IBD. Bowel urgency has been defined by patients as the severe and frequent bowel movements or needing to return to the bathroom due to unfinished bowel movements, how urgently or quickly one needs to go to the bathroom, the amount of pain and or cramping, the lack of control over urgency, the amount of discharge or diarrhea during the bowel movement, how tired one gets when urgency occurs, the consistency of stool, and whether accidents occurs. So you can see urgency is defined by a whole constellation of symptoms and descriptions around that word bowel urgency. But patients endorse bowel urgency as a common, bothersome, and disruptive symptom of inflammatory bowel disease. Remember, it can occur in both ulcerative colitis and Crohn's disease patients. Urgency symptoms can be present in both active and quiescent disease, and we're going to talk a little bit more later about that. Usually, we grade urgency as no hurry, hurry, immediately, and incontinence. And that's really that timing of getting to the bathroom. We know that bowel urgency is more common in ulcerative colitis than it is in Crohn's, and that it's one of the three most bothersome symptoms in ulcerative colitis. As you can see on this slide, the top most bothersome symptoms was diarrhea, but look at number 2, it was bowel urgency. Urgency is more highly associated with depression, anxiety, social impairment than either stool frequency or rectal bleeding. So it's rising to the top as a very common, important symptom. Sometimes bowel urgency is not addressed as a separate symptom of ulcerative colitis, but tends to be put together with stool frequency and rectal bleeding. Stool frequency refers to the number of trips to the bathroom that involve the passage of stool, mucus, and or blood over a given period of time. But bowel urgency is the leading reason for treatment dissatisfaction in ulcerative colitis. And we aim to try to change that. So, how common is urgency in IBD? Well, the prevalence is quite varying, but it's a worldwide problem. For example, a Japanese internet survey of 500 patients with ulcerative colitis, more than 50% reported bowel urgency and 30% reported incontinence. In various studies in the United States, it's about a report of 20 to 30% in ulcerative colitis and lesser in Crohn's, so 16% in Crohn's disease. One study reported that more than 80% of patients with colitis reported bowel urgency. As I said before, it's the second most commonly reported symptom and is significantly associated with increased patient perceived severity, meaning that patients perceive their disease to be very severe when they have bowel urgency. So let's look at what patients say. In a survey of 129 patients with inflammatory bowel disease, urgency was reported as the most important symptom, especially urgency with incontinence. In one study, 76% of patients reported wearing a diaper, a pad, or protection at least once in the last 3 months due to fear of incontinence. In a study in the UK on urgency, 74% of participants reported fecal incontinence. And in another study, about 30% of patients felt embarrassed to discuss urgency with a medical professional. When asked to rank the top 3 symptoms they felt most reported by their patients, 76% of healthcare providers failed to identify bowel urgency. So you can see there's a discrepancy between what providers think about bowel urgency and what patients are reporting. Excitingly, the foundation interviewed a few IBD patients about their experience with bowel urgency. So, first, we have Shannon, who's going to share with us about her most bothersome symptom since she was first diagnosed with IBD.
So I was diagnosed with Crohn's colitis in 2019, and bowel urgency has been something I've dealt with the whole time. When I initially was diagnosed, I had really bad bowel urgency due to inflammation and active disease in the area, and it's something that I've dealt with even when I am not in a big flare. So now at this point, my bowel urgency is related to the spasming of the sphincter and the rectum muscles. So that's something that essentially my muscles become so tight that they are tired and weak. So if there's any content in the area, my bowels will not be able to hold that. So that causes me to have to run to the bathroom really quickly. So it's a very quick thing. It is not diarrhea at all. It has nothing. I've actually never had diarrhea with Crohn's. It's just the inability of my rectum to hold the contents.
We're going to move on to the causes of urgency. Urgency can be due to both acute inflammation, but also as a result of chronic inflammation. So, inflammation over time, the longer you have your disease. So, active inflammation is important because the treatment of urgency from active inflammation is looking at medication and treatment or a change in current medical treatment. Most patients reporting rectal urgency were more likely to have had higher disease activity compared to those without rectal urgency. So it is a symptom that can be a marker of ongoing inflammation. But do not forget that urgency can be there with chronic inactive inflammation. So a patient can have no active disease, not be in a flare up, be in remission, and still report urgency. What happens is over time, the rectum becomes less compliant. It doesn't enlarge or contract or hold as much as it did. So sometimes this anorectal dysfunction can be associated with urgency, incontinence, and tenesmus, which is when your rectum is sort of twitching, or we say rectal retching. Also, another cause of urgency can be irritable bowel syndrome, completely different medical problem than inflammatory bowel disease. Many patients with IBD also have IBS, which includes intestinal dysmotility. So things don't run the same, either faster or slower through the GI tract. And or they can have rectal hypersensitivity, which means that the patient has higher perception of what's happening in their rectum than they should, because in IBS, there is no inflammation in the rectum. We're going to move on to talk about the impact of urgency. And I think these pictures sort of tell the whole story. So, first, we're going to talk about quality of life, which is probably the piece that is impacted the most. We're also going to talk about psychosocial impact of urgency. And then amazingly talk about how morbidity and economics are impacted by urgency. So we're going to talk about quality of life. Bowel urgency, as you can all imagine, is associated with worse quality of life due to many reasons, including the urgent, unpredictable need to defecate, along with limitations to access bathrooms and increasing the fear of then having a bowel movement accident in public. Bowel urgency is also associated with decreased quality of life because of patients' need to wear diapers, pads, or other protection. In one study, 45% and 37% of US and European patients, respectively, with moderate to severe ulcerative colitis wore diapers, pads, or other protection at least weekly in the past 3 months because of a fear of an accident. Being a top reason for declining to participate in social events, sports and physical exercise, and work and school events is very common. As you can imagine, people don't want to leave the house when they have severe urgency. Playing sports, that's out of the question. Also, there's additional burden to map bathrooms, plan travel, carry a change of clothes, cleaning up, and planning for all of that. So again, people have a fear of leaving their house or apartment. And also, there's a huge impact on sexual health in patients who have urgency. This is really just what patients report in terms of bowel urgency. And we've put it together. You can see the references. These are reported by patients, right? They reported feeling trapped, dirty, lacking control, feeling sort of a worse daily functional capacity, limited physical activity, as I said before. And urgency is really the top reason for declining participation, whether it's school, sports, physical exercise. It's all because of the urgency and incontinence. And travel, people can avoid travel. Obviously, there's a increased social impairment. People don't want to go out. They don't want to visit friends. They don't want to meet with friends. So they avoid any social gatherings. In addition, there's a lot of stigma associated, obviously, with any incontinence. Any incontinence has a stigma, and this is a universal problem. And it's that stigma that then affects some of these other symptoms that we see on here, like panic and stress, forcing people to carry cleanup kits, change of clothes. As I said before, there's psychosocial impacts of urgency. We know that patients who have bowel urgency have an increase in anxiety and depression compared to those patients without bowel urgency. There's also an increase in panic, distress, and embarrassment. And patients feel that they're trapped. They certainly feel a lack of control around their lives, but about their bodies, right? And this can all lead to social avoidance, as I stated before, further aggravating the psychosocial impacts. Some people may then become more depressed and or become more anxious. And as I mentioned before, there's a significant social stigma around bowel urgency. There are other impacts of urgency. First is on morbidity and illness. Bowel urgency is associated with other IBD symptoms and can certainly be associated with flare ups. People with urgency have higher levels of pain, fatigue, and sleep disturbance compared to those without bowel urgency. And this leads to consequences of an increased risk of colectomy, increased risk of steroid use, and increased risk of hospitalization. So much so that even after adjustment for clinical variables, including rectal bleeding and stool frequency, bowel urgency was independently associated with a significantly increased risk of hospitalization, steroid use, and colectomy. And finally, another impact is economic. The annual total economic burden of urgency in ulcerative colitis is said to be between 8.1 and $14.9 billion US dollars per year. And these include direct costs of pads and diapers, increased healthcare utilization, as well as indirect costs, including those of loss of productivity and social isolation. This slide is from a study on patients' experiences with fecal incontinence. All these patients had IBD. There were thousands of patients in the initial questionnaire that was sent out, but then they did individual interviews. And from the individual interviews came these core themes. And remember, this is focused on fecal incontinence, which is a very sort of specific type of urgency, as you could imagine. So, first is the emotional and psychological impact. As you could imagine, I mentioned depression, anxiety. Then are different symptoms that we had talked about: urgency, pain, odor, gas, fatigue, unpredictable, loss of control. The stigma, what will people think? The lack of public knowledge about fecal incontinence and urgency. The practical coping strategies, which is nice that patients talked about, and we're going to hear about that too, how to be prepared, whether it's eating patterns, foods, but practical approaches to dealing with fecal incontinence. Another was access to the toilet, mapping, ability to map where the toilets are, quality of the facilities, and finally, the fear of incontinence. So it's important that patients understand how to address urgency at their appointments. Sadly, there are a lot of gaps. And while urgency clearly has been a symptom for many, many years, it's really just being looked at specifically now. There's been a lack of validated tools to assess and measure urgency, and some providers may not be aware of its importance, and maybe that they don't even ask the question to the patient about bowel urgency. And really, because of that, the impact is a little bit underestimated. But we do know that it is a key factor in treatment dissatisfaction. Remember to don't just accept it as part of your Crohn's or ulcerative colitis. Don't normalize it. Remember to speak up, even if you're not asked specifically about urgency at each visit. And remember that there are degrees of urgency. And if your provider doesn't use this terminology, you use the terminology. No hurry. Hurry. I have to immediately have the bathroom, and talk about incontinence. Now let's listen to some advice from Maisha, an IBD patient, about how and why she talks to her medical team about bowel urgency.
When I go to the doctors, my doctor don't specifically ask about my bowel urgency. I make sure to speak up and amplify my voice so that it can be heard. It's important to ask about bowel urgency because something else could seriously be wrong. And you want those tough questions answered.
This is from a study done and developing a bowel urgency rating scale, the UNRS Urgency Numeric Rating Scale. So hot off the press, hopefully you'll see this in your clinical practice when you see your providers very soon. If patients answer yes to whether or not they have urgency, this should be the next way to move on. And that should be, how severe was it? Remember, we talked about, at the previous few slides, I mentioned about hurry being right there. How quickly do you need to be close to the bathroom? So using the scale is just 0 to 10, no urgency, worst urgency possible. That might be very, very helpful moving forward in terms of treating and making sure that your urgency is improving. Remember, patients with mild to moderate urgency are 5.9 times more likely to have active disease. And finally, we're going to talk about managing urgency. I mean, the first is to make sure whether it's due to an active disease or inactive disease. As I said before, if it's active disease, you want to treat the inflammation. You want to change or optimize current therapy. But here are some other tips for managing urgency. First is diet, increasing soluble fiber, whether it be through food or supplements. Avoiding things like artificial sweeteners, high fat foods, limiting alcohol and caffeine. Staying hydrated, avoiding carbonated beverages. And what my patients say to me is they try to avoid any change to their diet before they might have to leave the house or go on a trip to make sure how that food may affect them. So they stick to foods that they know their system can handle. The next is medication. Again, treating the underlying mechanism. If it's inflammation, changing or modifying a therapy. But there are antidiarrheals. There are medications known as bile acid sequestrants, which were originally developed to treat high cholesterol, but they didn't do a great job. And we have other drugs for high cholesterol now, but we in GI realized these are great to help manage diarrhea and loose stools. And then there's low dose tricyclic antidepressants that can be used to help manage things like the anxiety and the depression, and may or may not help the diarrhea as well. In addition, other tips for managing urgency include physical therapy. Sometimes pelvic floor exercises and or biofeedback can be very helpful to manage the rectal hypersensitivity. In addition, as you could imagine, psychosocial support, whether it be formal or informal, including cognitive behavioral therapy, stress management, coping skills, and support groups. Let's hear a clip from Kagan, another IBD patient, share her experiences with getting mental health support for her bowel urgency.
When I initially was dealing with bowel urgency, there was a big level of like hopelessness because it is such a symptom that demands your attention and kind of interrupts like your plans and your life. It was a very difficult thing. And especially being a college student, I actually had to go to fully online for my freshman year. just because it was difficult to maintain like that normal and traditional schedule in schooling due to urgency and other symptoms. And that led to a lot of self isolation, going to therapy and having a psychologist who understood the complexities of living with the disease and dealing with those symptoms was a big part of my journey. And it really helped me to develop that hope and to have the mental capacity and the emotional strength to get through the symptoms such as bowel urgency and how they impacted my life. So therapy, getting that help when you need it, it's really important and it's really helpful.
These coping strategies came from a study that was done in the United Kingdom, which asked patients to explain their self management strategies for urgency. And this was in hopes to develop a online program, which could be sort of an enduring online program for patients to tap into. And they're really, very practical, and they both help prevent but also deal with the consequences of urgency. We talked a little bit about diet and hydration, bringing spare clothes and pads, the use of antidiarrheals, lots of sleep, mindfulness, like meditation, as I mentioned, yoga, some exercise, if that can be tolerated with the urgency, therapy, as I mentioned, the psychosocial support, certainly knowing the location of bathrooms, and really thinking about relationships at home and work, and maybe talking to them about the experience with urgency. We'd like you all to hear again from Shannon, who will share some helpful tips on how she copes and prepares herself in the event that she experiences bowel urgency.
So, one of my favorite tools to cope with bowel urgency on the go is what I call my butt bag. And my butt bag is simply a little bag that has a variety of objects that I might need, such as wet wipes. I love tissues with the lotion in it. I'll bring my barrier cream with me of choice. I will also bring a little mini fan so I stay nice and dry. And I will take that with me everywhere, whether I'm traveling, I'm going to work, I'm going to the gym, just in case there is an emergency. I think that's very helpful for me. When I do travel, I do make sure that I'm finding the appropriate accommodations. That sometimes might mean finding a room with disability accommodations in case I have to do any soaking for my body. That's sometimes really important to make sure that if I'm going on an airline, that I'm getting an accommodation where maybe I can board early, maybe I can be near close to a restroom. And in particular, what I also like to do is have an emergency bag in my car with a change of clothes, as well as adult incontinence pads, and just in case you need that. And I will tell you, I've had to use that in two different emergencies while traveling in the car. So it's really important to have it and then not need it, rather than need it and not have it. So stay prepared and bring everything you need. Never be concerned with that. And that includes food as well. I'll bring food with me when I travel. Lots of airlines allow you to bring that in, especially if you have a medical accommodation.
To learn more about bowel urgency and other IBD symptoms, including symptoms outside of your digestive tract, please visit the Crohn's and Colitis Foundation website on symptoms to watch for, which you can access through the QR code below. If you're looking to connect with other patients and caregivers, the foundation offers virtual and in person support groups. The QR code in the bottom right of your screen will help you to locate a support group nearest you. The IBD Help Center provides information and resources to patients, caregivers, and healthcare providers about inflammatory bowel disease. They're available by phone or email as well as live chat, currently Monday, Tuesday, and Thursday. The QR code is on the bottom right of this screen. This is my favorite. When you have an unexpected or urgent need to find the restroom, the Crohn's and Colitis Foundation can help. They've developed a campaign and an app to raise awareness and help patients have access to restrooms when they need it most. Search for We Can't Wait on your Apple App Store or Google Play and download the app today. I have this personally on my phone that I show to patients and tell them that this is an important tool that they can use. I don't wait to tell them about urgency, but I do talk about this with all my new patients to show them what's available. Just some closing thoughts on bowel urgency. Bowel urgency can be due to active and inactive disease in both Crohn's and ulcerative colitis. Bowel urgency is associated with decreased quality of life, depression, anxiety, and fatigue. And while it can be disabling, it can be managed and or eliminated. An absence of urgency is associated with improved quality of life, as well as decreased inflammation and improved disease control. Thank you very much for your attention.